Assalamu alaikum, Sina doctors, and thank you very much for having me on this Zoom session. Uh, First of all, thank you for Dr. Ayaz, Sina management, and Dr. Asif Ali Iman that for accepting my idea regarding telemedicine training program. So uh, we have already started this activity last week by making this WhatsApp social media group. And thank you very much for such a wonderful and marvelous reply and interactive activity over there. So to begin with, I would like to uh, tell you about this question which I asked you that what is telemedicine. So most of the time, uh, physician, general public, they don't have much idea what is basically telemedicine is. So telemedicine is, started when the telephone and, other technology came into, in public use. So it's not a new thing, but I'm going to share some facts about it that telemedicine is basically doing marvelous work to the people or patient who are, not in the stream areas. They live in a remote area. They are, not easily accessible by physicians and doctors. So uh, during this talk, I'm going to share some slides with you. So this is, basic survey conducted by
Healthcare and technology have been together since the invention of the telephone.
Yes, Mr. Benton?
Sally, would you please call Dr. Smith and see if I can get in to see him?
Right away, sir.
Once the internet began, and even before, physicians have used video conferencing, image automation software, and integrated medical devices to provide access to healthcare for those living in medically underserved areas. And yet, we found during an informal man on the street survey that few people know what telemedicine is.
Telemedicine. Ooh.
Something with online medicine. Maybe doctors are talking to you over the internet.
I have no idea.
Medicine that you sell over the telephone? No.
Maybe it means it's medicine that helps people with their addictions to their telephones.
I've never heard of it before in my life. Telemedicine would mean that it's something to explain medical issues in the United States via television or some electronic media.
Something online or through media that helps people with medical needs.
Telemedicine is hopefully something holistic.
Some people had a better idea than others, but no one nailed it. Simply put, telemedicine is medicine delivered from a distance. A resident of an assisted care living facility, for example, who has chronic health care problems, can be seen by a physician miles away without leaving the facility. Does a worker who becomes ill or injured on an oil platform hundreds of miles from land need to be flown to shore for medical treatment? Using telemedicine, a physician can make that decision remotely. And a child who becomes sick at school, interrupts the normal routine for working parents, presents the challenge of getting in to see a doctor, and may mean more days absent from school, unless the school has a telemedicine program.
That's awesome.
Actually, that seems to go with medicine these days. They have a lot of, you can call in, speak with a nurse, you can call in, and so virtual is even better.
I think that would really help people as opposed to just, going on WebMD and finding all this stuff that freaks them out. They could actually speak with someone.
Telemedicine solutions improve access to healthcare and outcomes because patients are seen sooner rather than later, and it holds down the costs. Telemedicine programs are gathering momentum. If you haven't had any experience with them, it's only a matter of time.
So moving forward, This is the basic public review regarding the telemedicine, and now I would like to share that telemedicine has, a very emerging role in primary care as well as uh, secondary care of um, treatment. And there is a pie chart which shows that how telemedicine basically taking part in uh, the provision of medical facilities to the patient. So let me share one more pie chart with you. अपना बहुत सा ख्याल रखिए अल्लाह हाफिज Well, this is a pie chart which shows 45, half of approximately half of the activity is based on MR number, that is electronic health record number. So most of the well-developed hospitals, they've been keeping the record through MR number. My patient Sehat app is in practice in Aga Khan Hospital for keeping this type of telemedicine activity. Secondly, if you see that a major increasing size of pie share of telemedicine, especially after COVID pandemic, then e-prescribing. E-prescribing is not related to directly physician. It's basically just after finishing your telemedicine session, there is a e-prescribing method. So that is related to other staff. Then big data system is there, clinical decision support. Then if you want to make any decision, you want to conduct any research, so all data would be available for that. Then the last part is the knowledge management system that this through this telemedicine activity, you'll be able to edit any patient doctor's performance. You will be able to select the topic where you want to encourage your physician or doctor for e-learning program. So this is how it goes. And one more thing that is very important, that it has got a multi-dimension approach. Once you get into it, you'll be able to learn a lot regarding this uh, activity. Well, after pie chart, so since telemedicine, telehealth, or you know, medical virtual learning basically is itself is a big industry. So I'm going to share the, gradual increase the number of, countries, number of regions that how they involve in telemedicine practice to provide primary care, remote area care, and making decision in different secondary and tertiary care management. So let me share one more, bar chart with you. This is another, projected telehealth or telemedicine industry growth. So you can easily compare that in 2010, and this is, we are here in 2020. So more we are involved in dealing with the patient, especially in primary care. So more we are into involvement of telemedicine industry through providing each and every facility. So sharing this graph is basically uh, reason behind that is to one should know that telemedicine is going to be the integral part, but not going to be, but it is the integral part of medical health practice. So we need to learn it and implement it through different. This is not relevant to our training program, but just I want you to have an idea that advanced micro devices, they publish different type of reports regarding the telemedicine development. So this is, development and involvement of the area of, global telemedicine. So that's how we need to know that there is a vacuum and a big gap in our area especially. So we need to learn it and implement it so that we can serve more people with less medical facility in their nearby areas. This slide basically, my provisional model as far as my knowledge is concerned related to Sina clinics. So these are my provisional model for Sina clinics. So first of all is a 0 point or screening point. 0 point and screening point is basically, where patient enter into the Sina setup. So there some 0 point where some questionnaire, should be asked related to screening if patient is having no such type of thing which causes, spread of the disease, then that person can easily go for routine clinic. Otherwise, there is a 0 point or screening point that in each clinic we can make a 0 point and screening point to screen whether this patient is going to the directly to the routine clinic or should that patient be shifted towards the telemedicine clinic. Second is glass framed room. Glass framed room, this is very unique idea I've seen in one of my, uh, friend who is doctor and practicing, you know, in the, public general clinic practice. So he basically made a glass framed in his clinic, and whenever patient visit there, so he just asks the patient to, move the hand if he want to examination to examine the musculoskeletal system, and he asks for the breathing and asks for different questions. And despite of that glass frame room, he's having the mic system available, that is the intercom system through which he uh, connect with this that particular patient as well. Thirdly, very simple telephone, can be carry anywhere for to talk to your related patient and ask about the problem, and note down the primary condition and note down the his or her concern and expectation whatsoever. Then after the simple telephone, there is mobile phone. Mobile phone has got different gadgets. There is a video call facility available through WhatsApp, through emo, and there is a video facility available through the different software like Zoom. That's what I'm doing here right at the moment. Skype is there. There is other so many software available to conduct video call conversation. And the sixth one is mobile van. Mobile van is basically Sina has been doing this mobile van facility for quite some time, and not only Sina, Indus Hospital is doing this as and this chest pain and pain management from NICVD as well. So this mobile van can be converted into telemedicine, station for any area, for any location, whatever uh, uh, condition is basically in need of a medical uh, facility or medical emergency whatsoever. Apart from that, I would like to one idea with you. That is, if five of among you, volunteer themselves for intensive program of telemedicine training, so they will be able not only to see patient through this telemedicine different type of method, but they will be able to learn how they keep data, how they uh, maintain referral system, how they maintain different telemedicine clinic. So I'm expecting only five volunteers. So as soon as I, share this video on your WhatsApp group, so kindly think about it and volunteer yourself for the intensive program. So that is the different program, and that will be on my, uh, my Facebook telemedicine training program. So that is not related to only for this Zoom meeting and something like this. So through this training, you will be able to not only understand simple telemedicine practice, but you will be able to understand the management of telemedicine. So I'm looking forward to have your positive reply. So for instance, if we have more than five volunteers, then we'll make two different group for their training. So first group will definitely train the other group, and that's how we continue this activity. Social media WhatsApp group is basically with a kind of whistleblower type you know activity that social media. I asked to make a WhatsApp group, not for the sake of this pre-activity of this Zoom meeting or this telemedicine training meeting, but also to use that WhatsApp group for your ongoing learning. So that is how that social, the CME WhatsApp group would be, definitely used for your personal grooming, your, medical learning type thing. Last but not least, I would ask you to share this message to other, doctors out of Sina if they are willing to learn something related to telemedicine. So they are more than welcome to join me. And I have, some Facebook telemedicine training program group. They can join there. I usually visit that on the basis of the need. If I have a group of doctors, so then I arrange some live session for them. So thank you very much for your time, and this power failure issue is just a routine thing. One more thing, that Q&A that is related to this thing. If you have any question, feel free to drop your question in WhatsApp group. I'll definitely reply whenever I get time. So expect the answer of your question in after finishing my working day activity. Thank you very much for your attention.